I love what I do, and it is so rewarding. And opportunities just came into play. When I graduated almost 20 years ago, I did not have any intentions of having multiple offices or anything of that sort. Everything that we do is customized. It's customized to each patient and what each individual patient wants to focus on. Having the multiple locations and having bought the third location, which was Royal Oak, some patients visited one office, didn't visit another. And when you needed access to charts or access to different information, we knew that we needed a system that was all going to be linked together. It was getting very tricky, using TeamViewer, calling over to one office, can you pull this chart? Can you email the notes to us? And so my husband and I figured there's got to be a better way. We've got to go to a cloud-based system. And so as much as we loved EagleSoft, we wanted to see if there was another, or if they provided a cloud-based system. And that's kind of how Fuse fell into place and how we were able, to implement it and bring it into the office. And we knew that it was gonna flow better for us as well as for the patient. And whatever flows better for the patient and flows better for us is gonna just make everything run more smooth. When we looked at other cloud-based systems, the ones that we looked at were not able to replicate the quality of the x-rays that Fuse was able to. And they were able to replicate them as close as they could to EagleSoft. And obviously x-rays are very important and essential in a practice. So that definitely was a key for us. We had on-site trainees here, which was amazing. They walked up and down the hallways. We had access to calling support online while the trainees were here. It's a learning curve, but once you get used to it, it's just trial and error with some things. But the clarity of the x-rays, where we decided to put patient notes, we changed a few things around in the way that Fuse, recommended or suggesting putting notes in, and we kind of collaborated as a team and found what would be the best way to access A, B, and C, and I think it worked well as a team. It's so nice to be able to pull up to a desktop, open it up, and open a patient's chart up, be able to communicate with the patient, try to figure out what's going on because it's right there in front of you. The other thing it works really well is when one office calls the other office regarding so-and-so patient, or sometimes you get offices specialties that will call and say, I'm calling regarding this patient. You say, well, that's a Royal Oak patient, but it doesn't matter anymore. That's a Bloomfield patient, because you just open up the chart and you're able to answer those questions. The support is always there to call and to fix the problem, regardless what it pertains to. If it pertains to our cone beam, if it pertains to x-rays, or if it just pertains to any accounting issues or anything of that sort. So having been a Patterson customer for many years, one of the main reasons we stayed with Patterson was a lot of the reps that Patterson had and the customer service that Patterson provided.